Any sort of patient, regardless of whether or not they're deaf or hearing, require medical care, not just from one person, but from multiple specialists, from multiple care providers, from multiple sites, right? Folks don't only come to their primary care doctor, but may need to go to the emergency department at times, or need to go to an urgent care. And just as we treat our hearing patients and being able to provide them with whatever language or services that they need, deaf patients also need the same. I grew up speaking American Sign Language. My parents are deaf. I do remember growing up and experiencing the healthcare system through my parents, who didn't have a lot of healthcare accessibility, and so it was really tough for them to navigate. And I remember thinking as a kid, you know, like, oh, I've seen my parents go through that. I don't want them to go through that. I want to be that provider that provides great accessible care to all patients, and especially the deaf and hard of hearing community, and being able to provide for them language that is accessible to them. So, you know, not just providing ASL, but providing it in a manner that is most accessible to them. Even though I sign, even though I use American Sign Language, I've noticed with some of my patients, it's still not enough as far as my ability to communicate with them. Oftentimes, folks who are not well versed in the struggles of this community may think, oh, you know, that person just needs American Sign Language. And the community is actually very diverse. The ASL interpreter does not necessarily apply to all in the form that we think. Facilities will offer tablets, but that may not work for a lot of deaf patients. Sometimes people actually need in-person interpreters. A certified deaf interpreter who actually is a deaf interpreter who works with an American Sign Language interpreter to provide enhanced communication to folks. That's something that is my goal in trying to get more interpretation like in-house, rather than only sticking with a tablet which may not work for everybody.